Thanks, Brian. So I'm just not going to present nearly as much data as you've just heard, but I want to give you or share with you, I think, how in Australia we've actually achieved something along the lines of almost coverage in our country of health systems thinking about or working towards the implementation of the Zero Suicide Healthcare Framework. So we have 4 states across Australia, Queensland, New South Wales, South Australia and Victoria, who have all begun the implementation of the Zero Suicide Healthcare Framework. The dotted lines, West Australia and Tasmania, are just starting to think about that now. And recently we had an invitation from the Northern Territory to go and speak up there, and I think that will be the beginning of the advocacy work in that territory. And so what this actually means is that something like around 85% of the Australian population potentially, when presenting to health systems, will have a better experience. Suicidality will be talked about openly. Suicide will be treated directly, and people will have an overall better experience. And that's what the Zero Suicide Healthcare Framework is aiming to do. On the other side of the equation are the people who are working in a zero suicide healthcare environment. And they too will have a better experience because they will be trained, they will feel confident, and they will be competent, and they will feel confident and be competent to work with people who present with suicidality. And that speaks to all of the people who may be experiencing a person who presents with suicidality, because that is not always the clinician. The first person that a person presenting with suicidality may see is not someone who is trained in working with people who present with suicidal behaviours. So that experience for all of the staff who are working within a zero organisation is also going to be a better experience. And there will be a belief by those who are working in the system that the leadership understands and believes that suicide can be prevented, and that a suicide or attempted suicide is an unacceptable outcome in a modern healthcare setting. Bottom line. So I just thought I'd talk about how we've managed to get to this point where there has been almost coverage across, and I say the implementation has started, and it's in varying stages of implementation. And even within that, there are varying degrees of fidelity to the system. But the point is that it is moving forward. So David mentioned that in 2017, Suicide Prevention Australia was the partner for the 3rd International Summit that was held in Sydney. And Suicide Prevention Australia, in the lead-up to that summit, really worked hard at speaking with state governments, because our health systems are essentially run by the state governments. And so there was a lot of advocacy work that was done in speaking with health ministers in each state, in speaking with the senior bureaucrats, because they're the people who make decisions about where money goes, and really trying to advocate for those state health systems to have representatives at that Zero Summit that would listen to and understand what we were trying to achieve with the Zero Suicide Healthcare Framework. And I think one of the important things to understand about Australia is we have a universal healthcare system. So that means that we know who present to our healthcare system. And if they present with suicidal behaviour, then we know who that person is. We know their name, and we understand that they have, we have access to them through that Medicare system. And so there is no reason why our health systems should not be able to look after those individuals, keep them safe, and link them into other services when they actually leave the health system. So the advocacy was really quite strong to get senior decision makers coming to that summit. And one of the great things for Australia, and I have to say is probably one of the most important levers that we've been able to utilise, is the fact that the Gold Coast Specialist Mental Health Service had already begun to implement the Zero Suicide Healthcare Framework. So at that meeting, we heard from Dr. Catherine Turner, who excuse me, is with us today. And Cathy and her team had really thought about how they would implement the Zero framework with high level of fidelity. And so Cathy was able to speak at that summit. And what that means is that our Australian leaders were hearing from an Australian clinical leader who was talking about this American framework in the context of the Australian environment. And that was critically important. And it really made, I think, a big difference to those senior bureaucrat leaders who came to that meeting to hear Cathy talk about the work that they were doing. At that point in time, this was 2017, so it was really only probably maybe 18 months into the beginning of the implementation, Kath, I would say, but it was still enough, and it was because one of our clinical leaders was standing up there and speaking about this. Leading on from that, that led to the Queensland as a statewide health service or a health system adopting the Zero framework and starting to roll that out. And the other thing that had emerged from the Gold Coast experience was the importance of really thinking about the culture that sits as a foundation for implementing the Zero framework. For any of you in clinical practice, if you have been involved with any adverse incident, health systems are generally very risk averse, and there is a fairly strong blame culture of who did what wrong and what are the consequences going to be. And so really trying, and a fear of disciplinary action. And so fear of trying to overcome that really meant that the health system had to look at the way it was actually thinking about and responding to the people working in that service for how they would manage when an adverse incident occurs. And the restorative just and learning culture, which again we'll hear from, and Joe Rafferty and his team at Merseycare have published widely on their implementation and the consequences, or the consequences being very positive outcomes that they've experienced. The other thing about the Gold Coast is that they published. And I cannot say to you how important it is for our literature to be referring to the Zero framework. So the work that has gone on that you've just heard about is critically important to get published. And I think at the time that this was published, I would say, bloody good job, Catherine. Please relax. Is that it? Yep. Yep. That's all right. And, you know, on cue.
It was an important moment.
It was an important, yes. I need to draw your attention to this point because I think at the moment, from my understanding, this was the single most successful suicide prevention single initiative that had been implemented globally. To see a 23% reduction in suicides for people who have been placed within their program on the suicide prevention pathway. So this was critically important, and to have it in the published literature made, again, it was another lever that we could draw upon. And the other great work that came out of the Gold Coast was representations. Now, if you're trying to convince a health system leader that you need to implement this framework, understanding that you're going to reduce suicides, but also that you can reduce representations, because to a health system leader, this starts to talk about the investment, the worthiness of the investment that they might need to make. So the pathway, for those people who were placed on the pathway, they had a reduction in representations to their health service. So critically important to get this sort of data published. I mentioned that the restorative just and learning culture was also a really important part of the Gold Coast implementation. And we've really learned from that. And one of the things that we try to encourage health services to think about is really creating this platform of restorative just and learning culture, so that the people who are working within the health service really feel that the system has got their back. So Professor Sydney Decker is a global leader in safety work, and he worked with Mersey Care and he worked with Kathy on their work on the Gold Coast. And we've since really taken up trying to produce some resources that will help health systems to think about what are the key components of shifting the culture from a culture of blame and fear to one that is focused around healing, recovery, and learning for improvement. And that's the basis of the restorative just and learning culture. And it focuses on forward-looking accountability. So you are looking to learn from any incident, not just a suicide, but any incident which occurs within a health system. There is a learning opportunity, and that's what we want to try and encourage. And again, Kathy and her team have published on this. They've shown that by introducing this new approach to the way in which they managed adverse incidents, they were able to reduce the fear that people had of disciplinary action. They were able to increase the belief that the organisation had their back. If something was going to go wrong, the organisation was there to support them. And this is critically important if we're going to try and bring all of our health services along this journey of the Zero Suicide Healthcare Framework. So this then is how Australia presents to leadership, and I have to acknowledge Joe Rafferty for giving us the idea of, if you're talking to a CEO, they need to see on a page what this thing is all about. So this is our effort, and I pay credit to my colleague Alan Woodward for really coming up with the bulk of this work. So we have the 7 elements of the Zero framework. Those 7 elements are built on a foundation of a restorative just and learning culture. And yes, we have the desired impact of reducing suicides and suicide attempts within a healthcare setting. But, and this is a big but, because I'm seeing a real propensity for health services to dive across to the right-hand side of the framework. And that is that there are clinical practice changes which ensure a person and their support network are equipped for recovery. Now, I understand why they go to the right-hand side of the framework, because that's what most health services understand, and that's probably easier. And so I don't resist an attempt to go down that pathway, but what I really would encourage you is to think about the left-hand side of the equation, the leadership, the training, the improvement, building the capability of system transformation. That's what we're trying to do. And that, together with the clinical practice changes, start to achieve the sort of outcomes that Australia's been able to demonstrate and that the guys have just been talking to us about this morning. But then, all right, so we have these wonderful goal that we're trying to reach. How are we going to do that? And this, I think, is the crux of the matter. There are 20 outcome statements that describe within each of the elements what we are seeking to achieve in implementing that part of the framework. And you really need health system leadership excuse me, to be giving you the right to focus on building the capability. And without leadership support, it's going to be very difficult because in my experience, the people who are implementing the framework don't have necessarily decision-making power. So you need to encourage the leadership to come onto the understanding what the framework is. And as Jo said to me, give it to me on a page, Sue. So here it is on a page. This is how you can show your leadership what it means to be implementing the Zero Suicide Healthcare Framework. And I think, thank you.